Welcome back. I'm Dr. Diaz, founder of Roots Health Direct Primary Care, where we're putting the care back into healthcare. And I'm so delighted to be joined today with Dr. Sandy Goldberg from Silver Lining. Hello, and thank you so much for joining us today.
Oh, it is my pleasure to do so.
Yeah, we know October is Breast Cancer Awareness Month, and we are so grateful to have the chance to speak with you today. The nonprofit you founded, Silver Lining, is just an incredible organization that supports breast health awareness and screening for women, regardless of socioeconomic standing or insurance coverage. Can you let us know a little bit about how Silver Lining came about?
A Silver Lining Foundation was born actually as a result of my being diagnosed with breast cancer. I was very fortunate. I had great support. I had great insurance. I had a husband who told me he didn't care what I had in terms of the number of breasts. And I learned after creating a small cable show that I was an anomaly. Now, this goes back when I was diagnosed in 2000. And I felt that I learned actually that people who were calling into our little cable show, in which I was the host, interviewing specialists in the field of cancer, that when I would answer all the phone calls, because I'm a Virgo, and that's what you do, is that people felt that they couldn't reach out for help because they had no insurance, they had no money, and they felt that they didn't matter. And that made me sick. So my husband and I, in 2002, started a Silver Lining Foundation, initially as an outreach and resource program. And then in 2006, we added our Buy a Mom a Mammogram program. And that expanded from screenings at one hospital to funding the entire spectrum of breast health testing, screenings through biopsy at 16 partner hospitals. And we turn, as you know, Dr. Diaz, no one away.
Yeah, no, that's really, really amazing. And I wonder what your experience has been, because as the years have passed, I've noticed a lot of patients end up, sometimes they have insurance, but their deductible is so high or their copays are so high that they're really unable to access care. Essentially, they're functionally uninsured, even though they have insurance. So they don't go to the doctor because they are worried about surprise bills, or they don't go to get tests done because they don't know how much it's going to cost. There's not a lot of transparency in pricing. And so it's just great to know that you're able to help women regardless of where they are, and that most women, I mean, there's a little bit of shame sometimes around not having the resources to be able to pay for these tests. And so can you speak to that and how you've addressed that?
Well, as I said, we turn no one away. And insurance in this day and age does not mean that you have insurance or you will get support or that you will get care. So what we did was we basically leveled the playing field. And anyone who comes to us, whether they have no insurance at all, whether they have documentation or not at all, we really don't care about that. And if you have insurance, you can't afford your copay, you can't afford your deductible, you need help, or your insurance will not cover those tests. This is when we step in. And we're fortunate enough that we have a group of partner hospitals whose philosophy is identical to ours, because to me, that's what it's all about. Everybody's supposed to get taken care of, right?
Right. That is the idea. Where did you first start? Are you Chicago-based, and then where have you spread to?
Well, we started off with one partner hospital, the University of Illinois Medical Center, UI Health now, and we spread out to 16 partner hospitals. We're looking at adding 2 more in 2024. The hospital locations range everywhere from Elgin to Rockford to Chicago itself to the metro area to the south suburbs. But we turn no one away, and we don't care where anybody comes from. Because now in this digital age that we live in, there are people all over the country who cannot access breast health testing, who call us and say, can you help me? I live in Arkansas. Or can you help my mother? She's here visiting from Romania. And the answer always is yes. We can't pay for the food. We can't pay for the transportation. We can't pay for the housing. That we cannot pay for. But the minute you walk in the door of our partner hospital with a service voucher from the Silver Lining Foundation, you are part of our family and you will be taken care of.
Yeah, what an incredible story. Just really inspirational, kind of taking your own journey. And I think it's the best growth story, right? Is when we have our own experience and then we're transformed by our experience, and then we share that with the world. And it's really a gift. It's really a gift. I'd like to hear what you think about during the COVID time and how that changed things for your organization.
Well, it changed things for our organization uh, because we were, as you know, many organizations, many worthwhile organizations during COVID lost their funding. Um, they lost a lot of their staff. They had to close their doors. They had to limit their programs, whatever was going on. Yet there were people who needed help, and they were sent to us at a silver lining. And where we were extraordinarily fortunate is that our hospital partners, although of course they were focusing on those patients who were going through that horrible COVID circumstance, which to some extent continues today, nonetheless, our our women and men were taken care of. For a while, the screening mammograms who walk in the doors were put on hold for a while, but anyone that needed diagnostic testing or biopsy or MRI and ultrasound, they were taken care of regardless of the circumstances. And even during COVID, we funded over 1,300 women.
That's amazing. So where can people learn more about your services, and how can people donate? And do you have any ways that people can get in touch with you, not just for services, but also for those who are so inspired to give?
Well, our website, obviously, a silver lining foundation, spell it all out, .org. And when you go to our website, there is a little tab that says, I need help or I want to help. And that's literally all you have to do is just click on. We love to get donations. We need donations always because we do not accept government funding of any sort, whether it be local, federal, or state, because we don't want anybody telling us who we can take care of. That's really what it's all about. The majority of all funding that comes to us goes to our programs. All of them are allied around either outreach and resource information, but basically on the front line, access to testing. And we've created a wonderful program as well for young women to learn about their own health advocacy and information. And we also created a program that addresses specific needs of those women who have been diagnosed, because as you say, it changes your life. It changes your life.
Yeah, that's phenomenal.
Yeah, just asilverliningfoundation.org. Again, don't forget the A, spell it all out. I need help or I want to help.
Yeah, and I love that. I love that there's two ways to be a part of, that you can really receive and you can give. And I think that's the gift here that, we get to experience. And I want to speak to your business model, because I think we're very aligned in this way, that it's really about the patients and it's really about what's best for their care. And it's really about the person, right? The person who's experiencing whatever the crisis in their healthcare is, or even just wanting their wellness, right? There shouldn't be a dictation between, insurance, government, or anyone else to tell us how to care for patients. And I think your services are just a gift to the community here in Illinois.
Well, we care. We care. I also know what it's like, and I had everything, and I know this stuff. And I hear the diagnosis, you have breast cancer, you are going to be operated on in 48 hours. And I felt as though I was hit by a bus. And I know this stuff. Now, here's someone that does not have access, that does not have the knowledge, that is focused many times as women. What do we focus on? Not ourselves, it's our families. So we have to take care of everybody around us. Or maybe we tried to access the system and we've been rejected over and over and over again. And to me, quite frankly, rejection is the worst emotion anyone can feel. Because then it's like, you don't matter. Well, to us, you matter. You matter. And you could put me on my soapbox. You know perfectly well, Dr. Diaz, I could talk about this for days. But the important thing to us is that those individuals that are listening and watching are aware of the fact that we are here to help. And we are certainly here to accept and need your donations in order for us to help. And what is interesting is that some of those women in particular, because that's basically who we serve, who have gone through rough times, who later have come out on the other side, have come to donate back
Of
to
course.
the ceremony. And you talk about somebody who did waterworks. They're coming. You helped me, and now I'm going to help you. I mean, is this not what it's about? Is this not what the world should be about?
That's right. Yeah. I love that you advocate for these women and that they come right back and give you the gift in return. I think the receiving is part of the giving. So,
well, I think people always talk about the perception of, you're giving, but it comes back to you a hundredfold. People, we're HIPAA compliant. We don't have to be, but we are. We figure it's hard enough for us to have to call a stranger for help, without everything being brass banded all over the place. But we do get calls, and I'll get some of the calls. And Dr. Sandy, I had my mammogram. Well, that's wonderful. Or I had my ultrasound, I had my biopsy. That's wonderful. I'm so glad we could help you. Dr. Sandy, I'm okay. I'm okay. You talk about a gift. That's the gift. That's the gift.
yeah. Well, thank you so much. The resource you provide and the gifts you give are really changing the world, and they've helped many of my patients. So thank you.
You are very, very welcome. Continue to send your patients to us. And, I thank you very much for the opportunity to talk about my baby.
Yeah, thanks for sharing.
You're welcome.